Thank you so much for meeting with us.
Thank you for the opportunity.
We are recording this interview on Friday, November 20th, less than a week before Thanksgiving. What's the status of the infection rates and hospitalizations in Clark County currently?
Yeah, so the infection rates or the case reports, the incidence is going up significantly. So it's actually, I would say, exponentially. The numbers are going up rapidly. So last, just to give you an idea, 4 weeks ago we were averaging 46 cases per day. And by the way, I also want to put that in context. We need to be below 9 cases a day to be in the low range of 0 to 25 per 100,000 over 14 days. 4 weeks ago, we're averaging 46 cases per day, which already put us into the high range. In the last week, we've been averaging 148 cases a day, almost 4 times that amount. We're well beyond the bottom of the high range. We're well into the high range. At that rate, actually, when we looked at the metrics, the 14-day metrics most recently, we were at 254 per 100,000 over 14 days. And, the high range begins at 75. We're actually exceeding that more recently. So the numbers are exploding. Uh, the hospital capacity has been good until we've seen some real changes recently. So there's one measure we use about hospital capacity, and it is you want 10% of the beds or fewer to be occupied by COVID 19 patients. A month ago, we were in the 4 to 6% range. This week, for the first time, early this week, we exceeded the 10%. I believe we were at 10.9%. And I just got off a conversation with hospital partners, and the numbers have increased significantly since then. So we're actually beginning to set records during this pandemic for people who are hospitalized with COVID 19. What really concerns me is that, well, there's a number of things that concern me, but the the hospitalizations lag generally a couple of weeks after the case increases because it takes a while for people to get sick enough to be in the hospital and then die. We're already seeing increases in the hospitalization based on our case rates, a couple of weeks ago. It's going to go even higher than that. And we look at bed capacity. It's one of the measures we use. But to be honest with you, we can add beds here and there. We can put gurneys in the hallways. We can put tents out and build put additional capacity in. But what we can't do is add. There's a finite number of doctors and nurses and respiratory therapists and all the other folks, the healthcare workers. We can't keep on adding healthcare workers, and that limits our capacity. I'm concerned as this goes on, including the pandemic. We're not only going to have healthcare workers potentially get sick, but they're also going to they're already getting exhausted. So I have real concerns about sustainability here if we can continue to go in the direction we're going in.
Just how dangerous is this virus? You hear all kinds of rumors. It's nothing more than a flu. How, how dangerous is this?
This is at least several times more lethal than the flu. Let me put the numbers in perspective. Each year, when we talk about an entire flu season, the flu in the United States kills somewhere between 12,000 and 61,000 people every year in the United States. Okay, and that's an entire flu season. In We're just still getting into COVID 19, but already this year, remember the worst flu year, the absolute worst flu year is 61,000 deaths. We've already exceeded 250,000 deaths in the United States, and we're not even close to being done yet. So in Clark County, in a really bad flu year, we have 25 flu related deaths already. And most years we have fewer than 10. Okay. The 25 is the bad year. Okay. So far this year, and we're not done yet, we've already had 90 COVID 19 related deaths in Clark County. This is significantly worse than the flu. It's not a hoax. It's not the flu. It is COVID-19, and it is far more lethal than influenza.
Okay. How does this virus spread?
Yeah, that's the other issue with COVID-19 is that it's airborne. It spreads through droplets. When we cough or sneeze or even talk or sing, the more vocal we are, and the more we expel these droplets, and then somebody who's in close contact, and we're defining close contact as being within 6 feet, and for 15 or more cumulative minutes, that they're at risk of becoming infected. It is very contagious. It can
A-
also land on surfaces, and you can get it by touching surfaces and then touching your eyes or your mouth, but or your nose. But that's not as common as the airborne spread, and it is a very contagious virus. And the other thing I want to add about this, and I didn't say it earlier, is one of the measures we look at is how many, we call it a reproductive number of the virus. And we look at, for each person who's infected, how many other people they infect. And if the number is above one, um, you get exponential spread. And right now in Western Washington, the number is 1.4. So each person infects 1.4 other people, who then each of them infects 1.4 other people. And it's kind of like I hate to compare it to compounding interest or something like that, but the number grows exponentially, and that's why we're seeing. I don't have a graph for you, but a lot of the listeners have probably seen the graphs of rates in the U.S. and in Washington. That curve is getting very steep.
And part of the issue also, you could be asymptomatic, feeling fine, but still spreading the virus, correct?
Yeah, so that is a real concern about COVID-19. So you can spread the virus for 2 days before you become symptomatic. So here's the deal: folks who are walking around who are already infected and spreading the virus don't know that they're sick, and don't know whether might even had contact with somebody else who was infectious, and can feel completely well and be expelling, coughing out, singing, talking, these droplets that are infected 2 days before they develop any symptoms.
So, what's the best way to protect you and your family during this?
Yeah, I'm gonna. So one of the things I want to mention is that there's a lot of myths going around, and I want to dispel those myths right now. Physical distancing, or you can call it social distancing, and masks work. They're effective. And actually, newer evidence, earlier we were saying, well, wear a mask to protect people around you. Newer evidence basically shows that the masks help protect you as well. There's a lot of nonsense out there. For example, that viruses are small; they get through the mask. That's fake news. Okay, viruses travel on these droplets that we talked about earlier, and the mask prevents those droplets from getting out into the air. Masks are effective. Physical distancing is effective. Limiting the amount of people you're around, especially people outside your household, again, who can be without symptoms, but the more people you're in contact with, the greater the likelihood, especially with the amount of disease we have circulating in the community right now, the greater the likelihood you're going to be around somebody who may not have symptoms but is spreading the infection. But physical distancing and masks work. The other thing I'd also recommend is frequent hand washing, which we've talked about as well because of the contacting the surfaces. Certainly, if you have any symptoms of COVID-19, fever, cough, shortness of breath, don't you know don't go out into public, and you should contact your healthcare provider. But and if you've been in contact with somebody who's had COVID-19, you need to be at home quarantine for 14 days after that last exposure. But I'm going to repeat it over and over again, especially as the holidays are coming up. The Thanksgiving holiday, physical distancing, masks work, and avoid contact with people outside your household. the concern I have about Thanksgiving is the poster child holiday for having these small social gatherings. And when you're eating and drinking, you can't eat and drink with a mask on. So have Thanksgiving with the members of your immediate household, and try doing it virtually with your other folks that you know really well.
Okay, and the same thing would go for Christmas as well. Christmas meals, obviously New Year's. Don't go to the parties. Don't.
You know what I
Those are
would tell folks?
recommendations.
Yeah, I know I'm giving all this sounding alarmist and all that, but it is a very lethal infection we've already talked about. That's not a hoax. But there is some light at the end of the tunnel. We have a couple of effective vaccines that we can talk about in a few minutes. And I am hopeful that if we can practice physical distancing, social distancing, wear the masks, avoid the contact we've talked about, and we can flatten the curve and get through the next few months, we can preserve lives, lives of, people who are dear to us in time to be able to have this effective vaccine. And then we can have the best Thanksgiving we've ever had next year where we can actually maybe be close with folks that we want to be close with physically.
So why? How does partial shutdowns? How do partial shutdowns? How do they, such as limiting grocery store capacity to 25% or closing indoor restaurants? How does that help flatten the curve?
Yeah, and when we talk about flatten the curve, we're talking about reducing transmission. And that's because, as I said earlier, the more people you have contact with, especially given that people without symptoms can spread this infection efficiently, the more limited contact you have, the less likely you are to be exposed to somebody with who's infectious. And the issue around dining and all that is, unfortunately, we have to take off our masks to eat and drink, and that increases the likelihood of, spreading the infection. So limiting the amount of, the contact you have in that situation is helpful.
So why is it important to get a flu shot this year, influenza shot?
It's always really important to get a flu shot. And,
You're right.
yeah, but this year, I agree, Jim. This year, it's especially important to get a flu shot because, first of all, flu still is a serious infection, and as we mentioned, it does cause illness and death. And given, having a season where you have both COVID-19 and influenza circulating, the stress on our hospitals and our healthcare workers who are these folks are heroes, and they're working day in and day out, and under very stressful situations to reduce the number of people who need hospitalizations, who need critical care, who need ventilators, to reduce that by preventing influenza and by people getting their flu shots is really, really critical this time of year. Influenza, getting the flu shot is still the best way to prevent influenza. And avoiding a scenario where we have influenza and COVID-19 together, that'll kill a lot more people and put an additional strain on our hospital and healthcare worker capacity. So this is the year. If you've never gotten a flu shot before, please get it now, everybody. And if you have gotten a flu shot before, get it again. This is a critical year to do that.
Now let's end it a little bit of hope, like you talked about. Vaccines. There are a couple of effective vaccines. It appears. Can you talk about what's the latest news regarding that?
Yeah, let me distinguish between efficacy and effectiveness. So the vaccines have a high degree of efficacy, which means the two vaccines that are currently being looked at have between 90 and 95% efficacy in terms of preventing disease and preventing complications. Preventing symptoms as well as complications from COVID-19. When I say effectiveness, is you can have a vaccine that's 90 to 95% efficacy, But if only a few people take the vaccine, it loses its effectiveness because you really do need to vaccinate a large, proportion of the population for it to be effective in reducing transmission. So I'm optimistic that we have some really good vaccines. I also want to get the message across to people that, when a vaccine becomes available, I'm hoping that people take advantage of it. It's going to be a bit of a while. We're going to, the vaccine as it comes out, we're going to be looking at um, providing the vaccine to people who are, first responders and healthcare workers who are working with, providing care to patients. We certainly need to get them protected first. And we're certainly, early on, we're going to be looking at people who are particularly at risk of the disease, including people in nursing homes, their long-term care facilities with, people with underlying conditions that put them more at risk. But we'll be rolling it out. Hopefully, the vaccine rolling out. I can't predict exactly when. Certainly, I believe early 2021. And the state has a allocation plan, and we're actually working with our healthcare partners. And we've convened a work group here with our healthcare partners here in Clark County to talking about how we're going to be storing and allocating the vaccine. So we're working on that. There is some hope though, because it is the two vaccines look really promising.
Good. Well, as we talked about earlier, there's been a lot of rumors and misinformation. Where should people turn to get that credible information?
Yeah, so there are some really good sites about to get the information. Yeah, on our website, and it's I think you might have the information,
Yeah,
Jim.
clark.wa.gov /public health.
Yeah, Washington. Yeah, and then the Washington State Department of Health website is a really good one, and it's doh.wa.gov, and also the CDC is a really good source of information also. So there is a lot of misinformation out there. Please go to the appropriate sources, and those three sources I have this our decisions really need to be made on the basis of science and medicine. This is not, the message I'm giving out. This is not a political message. This is an apolitical, non-political message. If we can get past the politics and just base our decisions on the appropriate, scientific information, we have the power to get this to flatten the curve and get this under control. So please, I urge people to use the appropriate sources of information. This should not be political. It should be based on science, and basically based on science and the best medical thinking.
Well, thank you so much for all you've done for the community to keep us going. And hopefully next time we talk, vaccines will be widely available and we'll be out of the woods.
Yeah, we won't be, we won't be doing this virtually, Jim. So I'll actually be in the studio with you. So look forward to that. And I really hope that people have I know it's, people are getting, well, we've heard the term pandemic fatigue. I understand that, but there are ways that people can celebrate. It's not going to be the same, but celebrate Thanksgiving safely and be in contact with their families. Without the physical contact with folks outside their household, and I'm hoping people take advantage of that. But I wish the best. Everybody does. There's still a lot we have to be thankful for, and certainly, two effective vaccines on the horizon are something that we can be thankful for as well.
Well, thank you again.
Bye.